This is our patented hybrid hinge knee, number K67. This particular brace was developed for your patients with the snow cone thighs or the large thighs where you have trouble fitting your patients. This particular brace is half wraparound and half sleeve. So at the top, the brace opens up. Patient slides on the brace over their foot. Then you can adjust this. It can go all the way around here. It can go right to the end, and as you can see how much more room it has on the thigh area. So a lot of times your patients, you can fit them with wraparound braces that fit well on the bottom, but they don't fit well on the top. Now, when we first developed this brace, you can also do this, but the problem you have with doing a larger thigh is then your hinge is not in the proper alignment, both medial and lateral, because it's either too far back or too far forward. So on this particular brace, what was patented on this brace is the brace hinge is sewn in at the bottom, but as it comes up to the middle of the knee, from that point up, it's in a casing. And you can move the brace hinge forward or backward once you put the thigh wrap on to make sure that you get exactly center on the thigh. This is what's patented on the brace, a really nice feature for allowing you to really customize the fit for your patient. I call this a precursor to a custom brace, because a lot of times you'll have to do a custom brace to get a brace to fit, and on this type of brace you have a large adjustment here which allows you sometimes 4 to 6 more inches in the thigh that you normally would not get on a normal wraparound hinge knee brace. This particular brace also comes with condyle pads, 2 C-shaped condyle pads. If you don't want them, you can take them out. But if you do take them out, we put the pile here versus the Velcro, so that way it doesn't stick the patient if you don't want them. And you can pop these back in at your desired area to fit your patient. The hinge itself, this is the K67H. This is a series of products too. We have a K67, this is the K67, I'm sorry. The K67H comes with a multi-position hinge which allows you to control hyperextension at 0, 15, 30, 45, and 60 to reduce the chance of a hyperextension injury. We sell a lot of these braces to in high schools and for linemen that want good support, but they have the big thighs and they have trouble fitting. This is a great little product for your everyday patient that just if they're overweight, they can't bend down a lot of times and put a brace on. This allows them to kind of grab, slide it on, and adjust it to fit them. It's a very versatile brace, and we do very well with it. We also have it with the K67HT, which is the high-tech hinge, or what we call our ROM hinge. This brace would bill out at L1832 with the ROM hinge. And then we have the K67S with the spiral stays, the flexible spiral stays down the side. So great little product, very similar to your basic wraparound knees on the market today, but what really is different with this is the features on the thigh which allow you to better custom fit your patient and move the hinge to the proper position so you really get the hinge in proper alignment. It has an open popliteal in the back, so no chafing in the popliteal area. We also, on this particular brace, same feature we have on our K64 wraparound braces. This is not solid. It comes apart and allows you to adjust it to where you can get it tighter or looser according to the patient as their leg expands, so you don't get the binding tourniquet effect as it stretches out. So great feature on the product. This brace also comes in a 17-inch length. This is a 13-inch length, and that would be our K68. It has boot pulls at the top to help once you slide it on to pull it up to the desired position.